9 pounds. 9 pounds. Clean the top of your bottles with rubbing alcohol before use. Since this dose is such a small amount, I'm going to be diluting it with a little normal saline first, so that there's enough to go through the needle and into the muscle. These are very tiny tuberculin syringes that are meant for, or insulin syringes that are meant for dosing very small amounts of insulin. They make a great little syringe for measuring very small doses of strong medication. They hold a total of 0.3 milliliters. Once it's drawn up, it gets an air bubble. Then repeatedly turn the syringe over, thumping it to mix the dose. If this is drawn up by your vet for you in single dose syringes, they will have already done this. But if it's been sitting for a little while, you'll want to redo it because there could be some separation. That's it, we're ready to go. So we have our second kid ready here, have our dose. With the last kid, I didn't even give the full dose and it still was quite good, so I'm going to do that the same with this one. So it's going to be intramuscularly in the little muscle back here in their leg. You pinch that forward so that you're clear from this little needle, from tendons, nerves. You don't pull out on the syringe because this needle is too small to show you any blood vessels. To allow blood cells through. The needle is so tiny, there's really no pain involved with it, which is lovely. And these kids are nice and relaxed anyway. Little massage here. This is a 4-day-old La Mancha, Nigerian, Saanen, Boer Cross kid, so can't even think of a good name for this. Depending on where this goes in the muscle, how close that injection is to a blood vessel, they'll go out quicker or slower. And we can always give a little bit more. But sometimes you give a little bit more and then they stay out even longer. That's the little sound that tells you it's starting to affect them and they're feeling sleepy. Now you may not be able to see this, but our little ears are starting to relax and drop. And they respond to your voice at this time too. Right, baby? If you have many kids to do, you can do about 4 injections, lay them all in a tub, or set them in a peaceful area so they can go to sleep. And then start with the first one that you administered the shot to, or the first one that's ready, and do a series of goats at a time. During our kidding season, I'm usually doing 8 to 12 kids a day. And when they're ready, they'll stop making that noise and their little heads will be very loose. Limp. Not loose. Limp. So our iron is heating up over here. I cleaned the tip of the iron with a brass bristled brush before I started. That's important. At this time, when they're sedated, it's a good time to inspect their teats for any extra teats or spurs. layer out in front of us. And we're going to clip the hair off around the bud first. Clipping the hair off helps you see the bud more clearly, and it also helps to reduce the amount of smoke in your face, and sometimes the extra hair burning will take away heat from the iron that you should have for the iron. So she's still a little bit more active than the other kid. It's okay if they're a little bit, if they're this far under, even if they make a little cry during this part, it's better than over sedating them. They don't have to be completely under for this to be very helpful for their pain control, and you can also do a better job too when they're not thrashing around. Put our gloves on. If the goat has long ears, you want to be sure to keep them away from the iron. I hold the iron close to my face to see how much heat. It's about this far off and there's an incredible amount of heat coming at your face, you're good. 7/1000. Beautiful copper ring was exactly what you want to see. I burn a little X on the bud. This is something some people do, some don't. I'm in the habit of doing it. And I'm going to hold our ice pack right on that bud, cool our skull off. The bigger the bud and the longer you have to burn, the more important it is to put ice on. It is somewhat optional, but if you feel better about doing it, do it. Cooling the skull. Their skull here is a double set plate of bones with a cavity in between. So it's pretty far from their brain, but yet it can heat their head and harm their brain. So. Check it with your arm. And then you can optionally apply a little wound coat, and this is a natural one with some pine tars, pine oils. And you have to let your iron reheat about 3 to 5 minutes, so doing this during that time gives you something to do. If this was a registered animal, in between doing horn buds, I would be tattooing their ears or their tail webbing if they're big enough. It's a good time to get all those painful procedures out of the way, and plus, like I said earlier, the kid being very still is going to help you do a better job. Helps your confidence too. You know you're not causing that much pain. Check our iron, tip the head over to the side, stabilize it, and I'm going to count 7 seconds. 7/1000. Nice copper ring. A little X. Ice pack. If you don't see a good copper ring after you burned, you will want to cool their head and then reburn it. Maybe counting half the amount of time and focusing on the area where you don't see copper ring. The copper ring tells you you've killed the cells there. And remember, this is cauterizing and sterilizing as it goes. So, you know, you don't have to worry about disinfecting their head first or anything like that. The cauterizing means they're not going to bleed even if you went through all the way through the skin. Feels good. Bit of that, and we'll go put her in the recovery room. Yeah, so there's our first little kid in there. She's asleep. I'm going to put her sister in with her so they have the comfort of each other's bodies. You would want their heads to be up a little bit versus down, so I'm going to put a little little extra straw under there. And then I'm going to cover them up. They'll sleep it off, probably about 3 to 4 hours. They'll wake up sooner, but they'll go back to sleep if it's nice and dark and quiet. If possible, you don't want their mom where they can hear her. She can hear them or they can hear her because it agitates them. If they're totally undisturbed, they will wake up without a sound, nice and quiet, get over it. If you leave them out in the open somewhere, where as they're coming out of the sedation, they start feeling helpless, they get anxious and stressed. So we're going to put this cover over them, leave a little air hole, little air gap, and that's it. So it's been an hour and a half since the procedure, and the kids are wide awake and quiet and looking good. In a few minutes, we'll put them back with their mommy. Thank you, babies.